Hello, hello friends. Today I want to talk to you about some myth about autism spectrum disorder. Over time, people have misunderstood the concept of autism. Some people say that, oh, well, it can be cured. Autism cannot be cured, it can only be supported. It is not a disease, it is a neurodevelopmental challenge that requires continuous support. That you have to understand, number one. Number two, also, people travel abroad, go for cell therapy across the world, trying to look for solution. Autism is not cancer that requires chemotherapy. Autism requires early intervention and continuous support. Also, an adult could be on the spectrum or what you say autistic. Autism does not happen to children alone, it could happen to an adult. So sometimes when you realize you have some disposition that you felt that, oh, perhaps it might not be ideal, you may also want to test yourself. Another thing you also have to understand, it is not peculiar to a particular gender. It can happen to anybody, either male or either female, and you have to clearly understand that. As a matter of fact, you don't need spiritual intervention, you need behavioral intervention, APA support, special education support, inclusive support, among others. And I hope that as we commemorate the awareness on autism spectrum disorder, we learn to be more empathetic. Children with the spectrum can be sociable, they can be empathetic, they can become whatever they want to become. Of course, not all of them can be talented, but some of them are most talented, and we have seen the case of a 15-year-old child who was globally recognized. So, and it can happen to anybody. It's not caused by vaccine. It's not caused by drugs. Globally, there is no one approach to understanding what causes autism. So, before you actually cast aspersions or say what is not appropriate, you know that it can happen to anybody. I hope you have learned one or two things. Thank you, and bye for now.